something like that, all right? The lateralis, or you can do lengthwise depending on the length of their knee. The problem with this that students have run into, if they go to the medialis, they go too far in and they pull in the adductors, which is a problem, right? And the same thing you have to watch if you go too far lateral. So if you do, you need to know enough when you start getting stimulation, it's the wrong muscle, you need to know enough to change it. If not, that's a huge problem because you're not doing what the patient needs, all right? So, I don't know if you want to stimulate this on that.
I haven't used this leg, I'd like to get that muscle
Do ya?
working.
All right, so let's bring, can you just, bring one of the machines over. So, let's go through, like this is a skill comp. So I pull that I'm gonna stimulate the vastus medialis, all right? So you make sure you find the muscle. So we're gonna say Russ, we're gonna do something called Russian stimulation to this vastus medialis, which is this quadricep muscle. What it's gonna do is to strengthen the muscle and help you a little bit with function, make you a little bit stronger maybe when you get up from a chair and with your walking and everything. So contraindications are, right, contraindication, I'd use one of the big three, all right, that we talked about. I would have done a skin check first. Can you feel me touching you? I don't see any abrasions, open wounds. There's metal in the area, take the metal out. They have to be at least an inch apart. And with Russian, you have to use the big pads. That's a problem. That's actually a safety fail when you think about it, because if you use Russian and try to put all this power under this little electrode, that's not gonna be a good situation.
So that's how we do it.
Yeah,
We don't
well,
have big pads. We just
yeah.
have little round ones.
Yeah, so, well, it may be a different manufacturer, but with this manufacturer, you have to use the big pads because it's too much power under the little one. It's gonna be too noxious for your patient, okay? Yeah, so are you gonna be able to,
You want short up or you want me to-
yeah, so the problem here, it's hard to isolate it out. So years ago, we were taught that a short arc quad would isolate it out. So maybe we'll do something with a little bit of external rotation, but like I said, the literature doesn't really prove it. So, but this is what we'll do. For the whole quads, like the rectus, you can either do sitting over the edge of the bed, or you can do a straight leg raise, exactly. Depending on the strength of your patient's muscle. So guess what? It's almost exactly similar to what we did yesterday. So you find Russian here on the machine. It goes for 10 minutes because they're thinking you're gonna start at 10:50. And again, 50 plus 10 is 60. That's one cycle. You get 10 reps to start with. It's a normal contraction. We just want to contract the muscle, that particular muscle. I'm going to start with 10:30 just for time's sake, but I would start with 10:50 so I don't fatigue him out too much. And the ramp time is going to be 2 seconds. So everything is really exactly the same except for bigger pads. It's called Russian, okay? And channel 1's lit up, so that's what we're going to do is channel 1. Huh?
Do you ever change the ramp time or no?
I usually leave it because that's the most comfortable. I hate to say always because I get nervous when I say always.
Even if like they're in,
Well, because
even if they're there,
Huh?
even if they have a
You can
couple
only do
seasons
one
already,
video at a
like,
time on school internet.
Yeah,
so
it's just more
just-
comfortable, so I'm not saying you never, but for you guys here, just keep it. And again, you know, most of you have your muscles are basically normal, so sometimes it's even more noxious for you guys. So what I'm gonna do is I'm gonna increase it. We're looking for that muscle to at least twitch or contract, and then you can put it as high as you wanna tolerate it, okay? Ready?
Yep.
All right. So I'm just, and I don't even really look at that. I look at the contraction. Do you notice? I'm not even really paying attention. I just do a steady.
it's starting to get tingle. There you go.
So do you want more than that or no?
There you go.
We all already on my bowl, that's fine.
That's good.
Very nice.
Okay, all right,
Pretty.
so I'm gonna start it, all right, so now can you kind of pull it up and hold, it doesn't look like an animal, an alien. And then when it shuts off, just lower it slowly to get the eccentric of the quad. So it's the same thing as yesterday.
That's the same thing, you can do the full motion if you turn it up enough, right?
Oh, yeah. Oh, yeah,
Oh.
it's that powerful.
Yeah.
Oh, absolutely, yeah.
Turn it up.
I've had people, when we sit over the edge, it takes the leg total on its own against gravity, yeah. All right, so we don't need to do any more. I'm gonna hit stop. So that can be the medialis. The lateralis would basically be the same way here, and you can rotate the leg. Let's do sitting over the edge. So, do you wanna do that too, or no? So let's do a little bit of everything.
Do it all.
So you can do a straight leg raise, but we'll just do it sitting, if that's okay.
And this is for the medialis?
That was the medialis, so maybe we'll do the rectus, or we'll do, both the medialis and the lateralis. So if you did the rectus, you know, you can almost see it here and here, so yeah, so we'll, huh?
For Russ, definitely see it.
Yeah, you can.
He's a Mr. Muscle, good looking ginger,
Relax.
great muscle tone.
Good looking ginger. I never knew what a ginger was until like the past year.
What?
We just never call people gingers. And I had to really think about it, and now I know, so relax. So sit up. So if this isn't parallel, you guys know you need to put a little something under here, right? A little towel or something I've really put to make it, can you grab a towel?
Or
Somebody?
there's that thing right there, the circular.
Half log.
That might be okay.
Yeah.
Is that okay? So, someone set the machine up for me, so I would go through everything again. We're gonna skip that because I just wanna see the muscle work and someone can work it. So you do your skin checks, everything is the same. And then someone can control the machine.
Yeah, 10:30.
Do you wanna control it since they're all taping it? Do you wanna just turn it up?
Is that the?
I don't like her leaning like that over the.
Those you have poor body mechanics right
Lordosis.
You're the patient, right?
Russ is turning it up.
Relax your
now.
legs.
Russ is cranking
He
it.
does not stay still.
So you have to just tell him when it's enough. It does look like something's
Doesn't
gonna
feel
escape
weird.
from that muscle, doesn't it?
Hello.
It's pretty disgusting.
Yeah, it's weird. Is it too high? Want me to keep going? Does it hurt?
That's good.
All right, and hit start. So you want to hit start, so you don't want to prolong it. And then as it, yep, straighten, hold, 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 hold. Keep holding, keep holding. Again, as you feel let go, just lower it slowly. Okay, and you go through that for 10 times. So during your skill comp or practical, you know, we'll make sure you've got a couple of those. Once we see a couple and here you facilitate, I'll stop this. Here you talk to the patient, make sure everything's appropriate. We'll say, okay, we've seen enough treatments done. So that's the quads, you practice all of those, and then let's do someone different, someone's gastroc. And we're